Hi, I'm Dr. Mark Miller. I've been in practice since 1980, and over those last 30 plus years I've done hundreds of hours of additional study with subjects involving the brain, central nerve system, the spine. We see so many conditions in our office, conditions that involve the whole body or conditions that involve the neck, the back, and so on. I want to visit just briefly about what happens to the neck and why people come in with neck pain. And that's a very interesting subject. The neck is very vulnerable. As you can see, it's kind of flopping around out here in space, not like the rest of the system that's held together with ribs and a lot more body mass. The neck is very vulnerable to injury. And when the neck hurts, and it can hurt from anything from a whiplash injury to just poor posture, which is a lot less trauma, but it's an ongoing trauma. So we see all sorts of conditions involving the neck. Things like degenerative disc disease, disc herniations or disc protrusions, or misalignments in the system referred to as subluxations. So many of those conditions can cause neck pains. Frequently with neck pain we get associated headaches, because the nerves coming from the neck go to the head. And with pressure on those nerves, we can get this pounding migraine type headaches or just your daily headaches. We also see conditions where it's just localized neck pain, maybe going into the shoulders. We frequently see problems going into the upper extremities because we have 5 nerves that come off of our neck that go into each one of our arms, all the way down to the fingertips. That's how these arms and fingers move. And when misalignments occur in the spine, it can cause pressure on one or any combination of those 5 nerves, giving numbness, tingling, loss of strength, pain. If it's left that way, the arm starts to lose size, go into atrophy. So a lot of conditions can come from misalignments in the neck. I want to show you specifically how that would look like. So I want to show you what a model of a normal spine would look like. This is the model. Now this would be the front and this would be the back. As you can see that this would be the back of the skull. And so our spine goes right up to the base of the skull. Now normally our spine would have a nice curve in it when we look at it from the side. What happens with injuries, traumas, car accidents, sports injuries, is that the normal curve of the neck is altered, and that curve starts to straighten out, and it'll straighten out and straighten out. That puts abnormal compression on the disc. That's what starts the causing of the degenerative disc disease, these disc injuries, disc herniations, and so on. It also causes pressure on those nerves. You see, these are the nerves as they come off the spine. We have all these nerves that come off the spine going to all the different parts of the body. This area specifically, those are the 5 nerves that go to the arm. It's called the brachial nerve plexus. Getting fancy with you there. But any irritation of those brachial nerves, boy, that's what causes all that neck and arm pain. So I want to just visit here briefly about how exactly that occurs. It's really a neat thing to understand, and it's very understandable. So this is what a segment of our spine looks like. Again, the front and the back. Here's the disc. Here's the vertebra and the disc. That's the same all the way down the spine. Now these are the nerves. These right here are the nerves. They exit in between the vertebra. Both sides of the spine all the way down. Now again, here's the nerve. Watch what happens when the vertebrae slide out of their normal position. See how it presses on that nerve? Now if you had pressure on that nerve, you'd expect to feel pain, stiffness, muscle spasms, and so on. That nerve, if it has enough pressure, can cause pain all the way down into the arm, even into the hand, numbness, those type things. So if that's what's going on in your spine, then that should be corrected. If you go to some doctors, they'll just give you pain pills and say, hey, well, here, take this for the pain. But the reality is, the pain's not the main problem. The pain's there because there is a problem. And so in our office, we want to address the problem, cause, effect, And the effect or the results is the pain you're in. But the primary problem is misalignments in the spine. I've been doing this for 30 years. I see that to be the case nearly 100% of the time. So I want to go over what can happen when pressure is on the nerves. Now, you may feel pain here, but that's the nerve supply also to the thyroid. So a lot of our clients come in with thyroid malfunction. Their thyroid's not functioning right. They're having to take iodine or a pharmaceutical drug of some type to try to get the thyroid to function correctly. It could involve all of the glands up underneath here. You'd still feel the same pain, but that nerve supply goes to your immune system. Tonsils are flaring up, sore throat, laryngitis, stiff neck. Or it might involve things further up and you're feeling that kind of pain. And it's involving, again, all those immune system glands. It could even involve pressure going to the sinuses. Did you know that sinus problems actually is caused by pressure from misalignment in the neck? Those nerves come up over the top of the head and go to the sinuses. And a lot of our clients will come in with sinus headaches and so on, but really it's primarily a neck problem. It could be pressure on the nerves going to the head. Now those have a fancy word. It's called cervicogenic headaches. Migraines, those type of problems are caused from that. Or it might be a little lower, causing pressure going to the nerves into the lungs. Now a lot of those patients have asthma conditions. It might be pressure going to the lung and heart. So people are coming in with high blood pressure. High blood pressure, asthma conditions, heart conditions, in many cases are from abnormal alignment and abnormal function of what's going on in the neck and the nerve supply going to various organs. Another thing that can occur is that the brain and central nerve system might not be functioning correctly. If there's not proper firing in the brain, then those messages traveling from the brain. Now keep in mind, those are life-giving, life-sustaining, life-controlling messages that originate in our brain that go all the way down our spine and spinal nerves that run our body. So if that's not firing correctly, that could be part of the problem. In our office, we look at everything: brain, central nervous system, and the function of the spine. We have a special offer. It's our $77 special. You know, our first visit normally runs around $487. That includes exams, measuring of oxygen efficiency, testing of those nerves, including x-rays. All of that's normally $487. Special offer, $77. I'd love to talk to you about your healthcare needs. Feel free to call me. I'd visit with you on the phone. We'd love the opportunity to assist you. I'm Dr. Mark Miller.
I was on the freeway, and all of a sudden someone hit me in the side. I had neck pain, back pain, hip pain. The car hit me from the side and really hit me hard. And Dr. Miller examined me, and he treated me for about 3 or 4 times. After that, I was so much better. I got off of my pain pills. I didn't need a cane. And I recommend anybody to come to Dr. Miller. I recommend a lot of people to Dr. Miller. So after a few visits, my hip was really bad. I was off and running, and I was a brand new Della. I recommend anybody to come to Dr. Miller.